Thank
Okay.
you, Dr. Yewande.
Okay.
So let's make welcome Dr. Yewande. Let's make welcome Dr. Yewande. Thank you for coming. Thank you for accepting to share your knowledge with us. Thank you very much, Doctor.
Good evening, everybody. And
can you increase your volume? I'm very hot now. Diva, see what you've caused.
Good evening, everybody. Can you hear me?
Yes, we can hear you now, Doctor.
Okay, I'm Dr. Adegeye, and I finished from University of Ibadan, Nigeria, and I had my internship training at the University College Hospital, Ibadan, Nigeria. And it's a pleasure to be sharing some knowledge with us this evening. I'm sure that we've gotten so much information already today, so I will try not to bore us with my topic. I'll be sharing the screen now with us. Can you see my screen?
Yes.
Okay. So the topic is early self-detection of gynecological cancers. And gynecological cancers are cancers that are found only in women. And the reason why we've chosen this topic is because the awareness for these cancers are very low. And there's a high number of women dying every year in different countries of the world. And so we've chosen this topic so that we can be able to get familiar with some of the signs and symptoms that we'll notice that would prompt us to visit the GP for further tests. All right, so I'll first start by saying that cancer is not an infection. And what I mean is that it is not caused by something coming from outside the body. Say, for instance, like Dr. Bimbola took us earlier, COVID-19 is caused by coronavirus infection, and that's by coronavirus coming something from the outside, coming inside. But for cancer, cancer develops inside your body. It develops from your normal cells. So it just happens that your cells start growing abnormally. There's some other molecular things that happen, but I won't bore us with that. So what I'm trying to say is that cancer develops from our normal cells. And as such, by the time the cancer cells start growing, all the nutrients, the oxygen and the blood that should usually go to your normal cells now start going to the cancer cells. So the cancer cells start getting bigger and bigger. And then, of course, your own normal cells start dying off. So the person starts losing weight. The person starts developing some of the signs and symptoms of these cancers. Now, cancer is the second leading cause of death worldwide. And the commonest, because the leading cause of death is accidents. We have about 5 major gynecological cancers that we're going to be talking about this evening. And talking about statistics, in the UK alone, over 21,000 women every year are diagnosed with at least one of these gynecological cancers. And that means that a huge number of women, that's about 60 women every single day, getting told that they have a cancer. That's a huge number. And sadly, about 21 women die every single day from these cancers. Now, you can see that this statistics is just for the UK. We can imagine what figures they have in other countries of the world. So it is therefore important for us to ensure that our women are aware of these symptoms so that they can present early to the hospital. Now, there's no one specific cause of cancer. And what I mean is that you can't say, okay, COVID-19 is caused by coronavirus. You can't point to one particular thing that causes cancer. And so there are risk factors. These are things that put us at an increased risk of coming down with any of these cancers. And they're divided into 2 main groups: genetics, which means something hereditary in your family line, or environmental factors, which are other things that we do. For instance, for the genetics, I'll give an example of Angelina Jolie. I'm sure we all know her. She's a Hollywood actress. Her mother has a gene for breast cancer, and she went to do genetic testing and found out that she had the same gene. And she went ahead to, now that gene can put her at a risk of both breast cancer and ovarian cancer. So because she found out that she had that same gene, she went ahead and took out both her breast and her ovaries just to ensure that she doesn't come down with the cancer. So some other things that we do that may put us at risk for these cancers include smoking, drinking alcohol, poor nutrition, being overweight or obese, physical inactivity. We've been shown earlier some moves that we can do. You don't necessarily have to go to the gym. Just do a little bit of exercise in the comfort of your home. Then some chronic diseases like diabetes can put people at risk of coming down with these cancers. So this image is just basically showing us what is inside every woman. This structure is inside every woman. Of course, it's not as big as this inside everybody. This is just to let us know the different parts. And cancer can affect any of these parts that are shown in this diagram. So we'll just go briefly to talk about some of these cancers. The first one I'll be talking about is cervical cancer. And it's important for us to know that cancer does not know any age. So even if we say this particular cancer is common among a particular age group, it doesn't mean that if you're not in that age group, you can't have the cancer. It just means that if you're in that particular age group, you are at an increased risk of coming down with the cancer. So now cervical cancer, what's interesting about it is that it's a very preventable cancer. There's a vaccine available against the commonest cause of the cancer. The commonest cause of the cancer is human papillomavirus infection. And this is a sexually transmitted infection. And it's interesting to note that so many women worldwide, at some point or the other, have had this HPV infection at some point or the other, and the body just clears it normally. But it gets to a point where your body is unable to clear the infection, and then the virus remains in your body, and the virus turns your normal cells into cancerous cells. So these vaccines that are available helps to prevent against that infection. And the vaccines are usually given to girls from the ages of 12 years up to the age before they have sex. And for women who are sexually active and married women, we have the screening test. The screening test, for instance, is free in the UK. We do screening for women between the ages of 25 and 49 years. They are expected to do the screening test every 3 years. For women between 50 and 64, you do the screening every 5 years. And for those older than 64 years, if your screening tests have been normal for a while, they don't bother you about it. And if you've had your uterus removed at some point, maybe because of fibroids, you don't have to worry about the screening. So you can see how preventable it is if only we take these steps, get vaccines to our younger girls, and for the older women, try to do the screening. For Nigeria, the screening is not free. It costs about 5,000 naira to do the screening. I think in the UK, it's free. And so it's easily accessible if you talk to your GP. So some of the risk factors for coming down with cervical cancer are the HPV infection, like we mentioned, having HIV, smoking and drinking alcohol, having multiple sexual partners. And of course, as you grow older, you have more risk of coming down with different cancers. So what are those things that you would see that will make you, that should get you worried because they're not normal, and they should prompt you to go to your GP or go to the nearest hospital? So the first thing is abnormal bleeding. And what do we call abnormal bleeding? If you bleed after sex, that's abnormal. You should not bleed after sex. So if you notice that, you should visit your GP. Intermenstrual bleeding. Say for instance, you finished your period today, you're not supposed to see it until the next 28 days. And all of a sudden on day 14, you see some bleeding. On day 18, you see some bleeding. That's not normal. You should visit the hospital. Postmenopausal bleeding. We say a woman has reached menopause if for 12 good months she has not seen a period at all. So the moment a woman has not seen a period for a whole full year, you can confirm that the woman has attained menopause. So after that period, if you now realize that you start bleeding again, you should be worried and you should visit the GP. The age for menopause here in the UK, the average age is about 52 years, but it's less than that in developing countries like Nigeria, it's about 45 years. Also, abnormal vaginal discharge. Women have normal vaginal discharge, which should not smell and should not have any strange color. It should be clear. So the moment your vaginal discharge has a different color that's not clear and it starts smelling, you should be worried. If you have pain during sexual intercourse, you should be worried. And if you realize that you're losing weight and it's not your intention to lose weight, these are things that should make you go to the GP to complain so that they can do some screening tests to be sure. So go to the next one, ovarian cancer. The same, like I said, it can occur in any woman of any age. So some of the factors that put you at risk for ovarian cancer, if you have a family history of any cancer, be it breast, ovarian, prostate, you are at risk of getting ovarian cancer. Now, it's been noticed that there are some things that protect against ovarian cancer. And these are things that reduces the number of times you ovulate. And what are these things? If you have children, if you're breastfeeding, those two things reduce the number of times that you have to ovulate. So they've been noticed to be protective against ovarian cancer. So that means the reverse would put you at a risk. So things like not having children and not breastfeeding will put you at an increased risk of ovarian cancer. Then if you start menstruating early, and early meaning from the age of 9 or 10, you'll be at an increased risk. For late menopause, that means finishing your period later than normal, say 55 years, going into 60, you're at an increased risk. So what are the things you see? For ovarian cancer, the things you would notice. Now, the thing about ovarian cancer is most of the diagnosis is usually done very late. And why is that? It is because some of the symptoms feel like something you would experience normally, like indigestion. So you just say, you've eaten some foods, you're bloated, let me use some antacid, I'll feel better. And for some people, if it keeps coming on recurrently, you keep getting bloated and bloated, you should be worried because it might just be your ovaries getting bigger. So some of the things that you might notice that should get you worried, are you getting bloated or your tummy getting bigger? You realize that you can't finish more than 5 spoons of food. Maybe before you could eat a full bowl, and all of a sudden you can eat only 5 spoons out of a full bowl. You should be worried. Then if you, of course, if you start losing weight that you didn't plan, and if you realize that you go to toilet normally every morning, you have to use the toilet, and all of a sudden now you can only use the toilet maybe once a week, you should be worried. You should visit the GP. So the womb itself also can, like the picture I showed us earlier showed different parts, but this particular one I'm talking about is the womb itself, that's the uterus, can also become cancerous. The risk factors, just like the ones we mentioned earlier, if you have a family history of any cancer, if you start menstruation early, if you finish your menopause late, if you don't have a child, as you grow older, if you're overweight or obese, you're at an increased risk of coming down with endometrial cancer and uterine cancer. Also, what will you see that should get you worried? Abnormal bleeding, like we mentioned before, bleeding in between your menses when you shouldn't be bleeding, bleeding when you already reached menopause, bleeding after sex, pain when you have sex, and vaginal discharge that's smelly or has a color that's not normal. And when I mean normal, it means it's not crystal clear. Normal vaginal discharge should be crystal clear. So the last one we'll be talking about is vagina and vulva cancers. They're usually very rare and it's mostly seen in women that are older than 60 years. But just like I said, anybody can get cancer. So risk factors: increasing age, HIV, having human papillomavirus infection, which is the same thing that can put you at risk for cervical cancer, can put you also at risk of vagina and vulva cancer. So the symptoms you see: abnormal bleeding, same thing. I mean, if you realize that on a normal day, your period comes every 28 days, any other thing outside of that is not normal, should get you worried and should prompt you to visit the hospital as soon as you can. Then if you realize that you keep having to itch your external genitalia, the private part, you keep itching and itching and itching, Fine, you can have some itching after maybe shaving for like a day or two, but if it's persistent, you should be worried. If you find any abnormal swelling, maybe it looks like a boil or something, and keeps coming and coming, you should be worried. If you have a sore, an open sore on your private parts that's not healing, it's just there constantly, you should be worried. So we've mentioned all the cancers now. Those are the 5 major ones. I've gone through them already. I mentioned earlier that there's no specific cause of cancer, but if we can try to reduce some of the risk factors by living a healthy life, it would be better. Since we also know that even when these risk factors are not present, you can still have cancer. So we need to live healthy by avoiding smoking, either you smoking or living with people that smoke. Because even secondhand smoking, that is you inhaling someone else's smoke, can put you at a risk of cancer. Drinking too much alcohol, you have to avoid drinking too much alcohol. A little bit of alcohol is good for the soul. Then eat fruits and vegetables, regular exercise. You don't have to go to the gym, like I said earlier. You can do it in the comfort of your room. You could walk around your compound for just at least about 30 minutes every day. Safe sex, which of course will prevent against HIV and the human papillomavirus infection. Safe sex meaning use condoms, especially when you don't know who your partner may have been with. Then vaccination, especially for human papillomavirus against cervical cancer. So for those of us that have young girls from the ages of 12 and above, you can try to get them the vaccines. I don't know if they are free in the UK, but in Nigeria, cost about 27,000 to get 3 doses. And the 3 doses are usually completed within a period of 6 months. So that would be advisable to at least reduce the burden of cancer. So the good thing is, now that we know some of these symptoms that we should pick, the advice is that as soon as you notice anything that's abnormal, like we mentioned, you should go to your GP, you should go to the hospital, see whoever your physician is, tell them your complaints, be able to some tests.
Doctor, please, I'm going to interrupt you, doctor. Please unmute yourself while I mute everyone now. Okay?
All right.
Go on, doctor.
Okay, so what we're saying is that a lot of women die from these cancers every day. And it's because most of us don't even know things that are normal or abnormal. So now that we know some of these things that are abnormal, that will prompt us to go to the GP or to any hospital, we'll be able to pick these cancers very early, because early diagnosis is key. And cancer is not a death sentence. Cancer is not a death sentence. There are people who have been diagnosed early, treated with different forms of treatment, either surgery by taking out the cancer, chemotherapy, giving drugs to kill the cancer cells, and all other forms of treatment. So I'll just show us some pictures, if you don't mind. This is what the normal cervix, the one on the left, the pink looking one. This is what the normal cervix should look like. Of course, you won't see this from outside. All we see outside is just the normal private part, but this is inside. This is what your doctor will see if they were looking. When somebody has cervical cancer, this is what it looks like. And you see that everything is distorted. There's some redness. And then this, the outer portion, you can see it looks pale, as if there's no blood there. That's what happens when there's cancer. All the blood leaves the normal cells and start going towards the cancer cells. So this one is redder than the normal cell. So another picture I have here is, this is what normal external genitalia private part should look like. Of course, the moment you start seeing even before it gets to this stage, a little lump should get you worried for you to go to the GP. And of course, you can't really get a picture for ovarian cancer because the ovaries are inside. So, but this is what the normal ovary should look like. The one on the left, small like that. but the cancerous one, you can see how big it is. Now imagine this thing getting so big, staying in your tummy, and then you start feeling
Can't
bloated
see
and you think,
anything, no, I can't see anything at all.
can you see the ovaries? The big one, if this one stays inside the tummy, it can make you feel bloated. So you might just think you overhead, or you overhead. So
Sure.
sometimes it might not be the case. And then of course,
Okay, me check.
imagine this occupying so much.
Okay, can you?
Doctor, please unmute yourself, please.
Okay, ma. Imagine this whole thing occupying the tummy, and then all you can eat is just 5 spoons of food. So you see the difference. Then the last one now. This is the inside of the womb itself. So both the inside and what lines it, all of them, all the different parts can be affected by cancer. So in conclusion, we've talked about different cancers, about 5 of them, and we've talked about them because we found out that so many people are not aware of these cancers. And that's the major reason why there's been so many mortalities and so many deaths from cancer. And we don't want to keep losing our women every year in different parts of the world to some of these cancers, which usually we lose them majorly because of late diagnosis. So it's important now that we're aware of these symptoms for us to report early to our GP where they can do further tests, and then which will aid their diagnosis. And it's also very vital to live a healthy life, just like the theme of this event. We've been talking about living healthy. So do all the things you need to do. Avoid smoking, avoid drinking, do some exercise, eat fruits and vegetables, and do everything you can to live a healthy life. Thank you very much.
Thank you, Doctor.
Any questions if you have?
Yeah, we've got questions here. Please, if you have question, audience, you can type it. But I've got some questions written here, Doctor, for you. I have been having vaginal discharge for over 4 weeks. Could this lead to anything damaging?
Okay, it depends on the kind of vaginal discharge the person has been seeing. Like I mentioned earlier, the only kind of vaginal discharge you should see, the color should be clear, not even white. If it's white, it might be some form of yeast infection, clear like glass. And it should not be so much, it shouldn't be itchy. So the person would have to describe to us what the color is like, if it has a smell, if it's itchy, and all of that. So if the person wants to talk privately, that'll be fine. And if not, maybe the person needs to visit the nearest hospital.
Thank you, Doctor. I have another question here. What of if it seems you are having your period, not you, Doctor? That's how the question. What of if you are having your period in about 3 times in 40 days? Should you be worried?
All right. On a normal day, your normal cycle for one cycle should last between 21 to 35 days. So if somebody has 3 periods within 40 days, that means that's less than 13 days in between each period. That's not normal. The person should visit the hospital. The minimum number of days between your periods should be 21 days. The maximum is 35 days. Anything less than that or more than that is worrisome. So 3 periods in 40 days is worrisome, and person needs to visit the hospital.
Does any emotional situation, does it have impact on that kind of question? Maybe you're going through some stuff, you're anxious, you're...
Oh yes, there are so
Would
many.
that be part of the issue?
Go ahead. Yes, there's so many things that can affect your period. If you're under stress, if you're under some form of stress, you can see your period. Your periods might come more often than they should, or take longer before they come. If you're exercising too much, it might affect your periods. And yeah, if you're under any form of stress, it actually does affect the period.
Thank you, doctor. I have been having pain in the breast. Could this be an indication of breast cancer?
There are so many things we would need to ask apart from the pain. We need to find out when the pain happens. Is it all the time or happens during your period? Because sometimes, not trying to use any medical term, but there's some form of there's some form of breast pain that can come during your period, and some that can come when it's not your period. So there'll be other questions we need to ask. If the person is okay asking privately, I don't mind. But for you to say somebody has breast cancer, it's not just about the pain alone. Are you noticing any lumps in your breast? Are you seeing any abnormal discharge coming out from your nipples? Can you see any open sore on your breast? Or can you feel like your breast is stuck to your chest, like hard and stuck to your chest? These are other things that you would think of, not just pain alone, for you to think somebody has breast cancer.
Thank you very much. What is BV in women? Bacteria vaginosis.
Okay, bacterial vaginosis is one of the genital tract infection. It's caused by, I'm not sure if I want to bore you, but it's caused by a microorganism, and usually occurs in, say, a genital tract that is not, I'm trying to look for a way to simplify that. For it's caused by something external to your body, obviously, by a microorganism. So when it gets access into your genital tract, you start having fishy smell. So you just realize, I mentioned earlier that your vaginal discharge should not have a smell and should not have a color. So when someone has bacterial vaginosis, you start seeing color like greenish vaginal discharge, start seeing fishy smell. You should be worried. That's what bacterial vaginosis is.
Okay, one last one here. Can hormonal imbalance lead to cancer?
That's a very complex question, because we would now start asking what kind of hormonal imbalance, right? And because that's a really complex question, because we need to find out what kind of hormonal imbalance the person is talking about. If it's the hormones that have to do with female reproduction, which is estrogen and progesterone, there's some imbalances that can lead to, it won't lead directly to cancer, but it will put the person at a risk for a particular cancer.
I've got few people raising their hands. I don't know if this has been there before, but I can see it. So if you are just raising your hand for question, I'm going to call you out. But if it's been there before, then please drop your hand so I won't call you out. I've got Ajadi here.
I can see a question, Miss Mary.
Oh, you've seen a question there.
Yes, somebody is asking what the meaning of nulliparity is. Nulliparity means not having a child. The person may have been pregnant, but at least the baby not getting to term. That's what it means by being nulliparous. Then dyspareunia is painful sexual intercourse. And dysuria is you feeling a burning sensation when you pee. On a normal day when you pee, you shouldn't feel anything, you should just pee normally. So if you have burning sensation when you pee, that's what dysuria is.
Thank you very much. I've got a name here, Ajadi. Do you have a question? Or mute your mic, please.
Yeah, I was just about to call your attention to the questions. I don't have any questions.
Oh, thank you very much. Then I've got Fadeke here. Do you have a question? Please unmute your mic. Your hand is up.
No, ma'am.
Okay. I've got Christiana here. Your hand is up.
Yes, ma'am. Thank you, doctor. Thank you so much. Very informative. I just wanted to bring you back to the point where you spoke about BV, because if somebody is suffering from BV, does it always have to be that they're itchy, or is it just the smell?
What's the question? Can you come again, please?
With BV,
Yeah.
bacterial vaginosis,
Okay.
right? Does it always come with a smell, or is it an underlying thing that you cannot notice?
It will come with a smell because it's not normal. It's caused by a microorganism. On a normal day, there are some microorganisms that keep the genital tract, the private part, that keep the pH of your private part at a normal level. So the moment you have something foreign coming from outside, nothing is going to remain the same there. So you're going to have fishy smell, and you're going to have an abnormal vaginal discharge that is not the normal color. So something greenish or yellowish.
So is that something that could lead to cancer? Does it need to get checked out, or?
There's been no documented relationship between bacterial vaginosis and cancer, but it needs to be treated. Usually they give you antibiotics, oral antibiotics, or if needed, they'll give you suppository, that's vaginal. But most times it's oral antibiotics. You just get treated and it goes.
Thank you. Just one last question I was going to ask you, and this is relating to myself. I'm not ashamed because I believe that Black people, one of our downfalls is that we don't like asking questions. Personally, for me, every time I'm coming onto my menstrual cycle, I always get thrush, and I always have to use not just canesten, but the dispository as well. Is that normal?
Okay, so there's some factors that can put you at risk of having vaginal thrush, and usually we don't try to begin with giving suppositories. We'll try to tell you about some hygienic practices, like wearing cotton panties instead of linen or silk. Wear cotton panties. Then, of course, when you're going to bed at night, you don't need panties for anything. Let some air get there. Then you shouldn't douche, shouldn't overwash the vagina, because the vagina has its own self-cleaning mechanism. So all you have to do is wash with some water and mild soap. There's nothing like, because some people try to do some rigorous washing, saying they're trying to clean it out, it smells. The moment people do that, you're trying to wash away normal protective features of the vagina. That's when people come down with oral thrush and vaginal thrush. So what we advise is you try to wear more linen pants, don't douche. Then, of course, in Nigeria, so many people use antibiotics. They just use them. They have common cold, they use antibiotics. The more you use antibiotics, the more it clears the normal flora in the body. So you usually notice that people that use antibiotics too often are predisposed to having vaginal thrush all the time. So, but then if you keep getting it frequently, it shouldn't be too much of a big deal, as long as you're visiting a doctor who is telling you to use the suppository. But you can try to do some of those lifestyle changes to help reduce the frequency at which you have the thrush.
Okay, thank you so much, doctor. Very informative. Thank you.
You're welcome.
Thank you so much, doctor. Thank you for your time. Thank you, thank you, thank you.
You're welcome.
On this note, we are going to bring this event to an end. But before we go, I want to give some credit to a few people that have made this event to come to existence. I want to appreciate you. Thank you very much. Firstly, I want to appreciate Ms. Fadeke Atiku. Thank you very much. You are such a wonderful soul. Thank you for your support. Thank you for being there. Thank you for putting this together. You worked underground and it was a huge success. Thank you. I want to appreciate you, and I say God will reward you. Thank you. I want to appreciate the COVID-19 and my health and my wealth team. Team, you are wonderful. Thank you very much. They are all here with me. Thank you for being there. We've been on this for the past 1 week. We've been praying, we've been fasting, we've been on the system. We've been working all night to make this happen. Thank you, everyone. God will reward you. I want to thank my prayer team. I cannot but forget you. I won't forget you. I cannot. I won't. Thank you for being part of this success. Prayer team, thank you for your prayers. These people have been praying. Today is the 12th day that they have been praying concerning this event. Thank you very much, prayer team. And I want to thank everyone. We have well over 100 viewers now, both on Facebook and Zoom. Thank you for believing in us. Thank you for staying tuned. Thank you for not leaving. Thank you for coming. You were invited and you came. Thank you very much. And I want to appreciate every single soul that have supported us in sharing this advert on your page. Thank you very much. It is your page. You have a choice not to share it. There are so many people there, they ignored it. They do not know how important the information we have gotten here today. They are facts and they are real. Thank you for doing this. My God will reward you. Finally, I want to appreciate our admin manager, Mr. Shegun. Thank you very much. This guy has been working, as if there's no tomorrow for the past 1 month to make this happen. She has been on the system. He took over my system from his end. Thank you very much, Shegun. You are just the best. Thank you for your hard work. I want to thank everyone. Thanks to my family. Thanks to my husband. Thanks to everybody for the support you have given us to make this a reality. I want to appreciate you. God bless you all.